All right, let's just dive right into this explainer. Today, we are looking squarely at the subtle 2024 CMS changes that can literally make or break your addiction treatment claims. Look, if you're a behavioral health billing professional or you run a treatment facility, you already know the stakes here are incredibly high, right? The rules are constantly shifting under your feet, and getting this right means smooth, predictable revenue cycles. But getting it wrong? Well, that means endless denial headaches.
So, I've got to ask, is your billing department truly ready for 2024? I bring this up because the Centers for Medicare and Medicaid Services dropped their annual update back in September 2023. And with the new year fully in swing, you might be thinking you already have your systems completely dialed in.
But here's the reality check. The CMS update actually included 349 minor editorial changes. Now, the overall addiction treatment code set didn't get a massive ground-up overhaul this year, which is definitely good news. But you know how it goes. It's rarely the huge overhauls that trigger a massive audit. It's almost always the minor editorial tweaks that just kind of slip through the cracks. These subtleties are exactly where claims get caught and denied during concurrent utilization review. The devil is absolutely in the details here.
So to navigate all this, here is our roadmap. We're going to quickly break down the 2024 telehealth billing rules, look at the top outpatient billing codes, examine coding for residential treatment, and finally figure out how to streamline your entire revenue cycle. First up on the agenda, Section 1, the 2024 telehealth billing rules. This is the biggest landscape shift we're seeing for behavioral health this year, as regulations finally adapt to a post-COVID world.
And the magic number we're looking at here is 95. So, telehealth rules have relaxed in terms of access, but the billing requirements, they've actually become much more specific. In 2024, all in-home telehealth services are no longer eligible for in-facility rates. Instead, they have to be billed at non-facility rates. You achieve strict compliance with this new rule simply by adding modifier 95 to all of your in-home telehealth claims. It's a really small addition, but it is absolutely vital.
Which brings us to the new compliance requirements for place of service codes. You now must clearly distinguish exactly where the patient physically is during the session. Place of service 02, that's used when telehealth is provided outside the patient's home. Conversely, place of service 10 is strictly for telehealth provided right in the patient's home. Precision here is simply non-negotiable if you want clean claims on the first pass.
What's really fascinating here is how you construct a full clinical picture for the payer. Because you aren't just throwing modifier 95 into a vacuum, right? You can actually stack it alongside specific demographic and program modifiers to tell the payer exactly who you were treating. Think HA for children's programs, HB for adults, HD for pregnant or nursing women, HF specifically for substance use programs, HV for state-funded agencies, and TG for complex or high-level care. Stacking your modifiers accurately basically ensures you get paid correctly for the exact patient population you're treating.
All right, moving to Section 2. Top outpatient billing codes. If we trace the actual patient journey, let's start right at the beginning of outpatient care and look at the codes your facility likely uses day in and day out.
It all begins with H0001HF. This is your introductory assessment code for patients entering a substance use program. It covers that holistic biopsychosocial evaluation of a patient's physical, behavioral, and mental health. And hey, a great insider tip to notice here, providers will often pair this with a specialized taxonomy code, like 261 QR0405X, just to clearly signal to the payer right off the bat that they are an expert SUD provider. But pay really close attention to this next requirement. Your intake process absolutely must resolve to a working F1X ICD-10 diagnosis and assigned treatment plan before any subsequent sessions are billed. Why does this matter so much? Because payers will rigorously audit the date of this first signed plan against the date of the very first billed counseling session. If there's no distinct linkage between the diagnosis, the plan, and the session during utilization review, those units are going to be immediately denied. No question.
So once that plan is securely in place, you move to H004HF. This code picks up exactly where the assessment leaves off. It's your primary bread and butter code for all billable hours spent in one-on-one therapy with the patient. Notice the HF modifier here. This specifically communicates to the payer that this counseling is happening within a dedicated substance use program. If, say, you were providing this in an opioid treatment program, you'd swap that out for an HG modifier or an HH modifier for a dual diagnosis program.
Okay, keep the number 15 in mind here, because in the billing world, as we all know, time works a little differently. H0004FF is strictly billed in 15-minute increments.
So if your clinician performs a standard 60-minute one-on-one counseling session, you are billing this code 4 times. And remember, every single one of those 15-minute units needs to be backed up by a signed progress note citing the active F1X diagnosis and that session's specific objective.
Next up in the outpatient journey is 96164HF. This code is used specifically for in-person group counseling sessions for substance use disorder. And that in-person part is a key distinction from the telehealth situations we were talking about earlier. Once again, you see that crucial HF modifier signifying the SUD program context.
Now, unlike the individual therapy code, 96164HF operates on a 30-minute unit structure. This means if your in-person group session runs for a full hour, you are billing this code exactly twice. Getting these time-based unit increments wrong between the individual and the group codes is a completely avoidable source of revenue leakage, so definitely double-check your facility's billing rules here.
All right, Section 3, Coding for Residential Treatment. Let's look at what happens when a patient's needs escalate to higher care.
When you are dealing with residential addiction care, the focus shifts to a tier system, primarily H5417, H5418, and H5419. These represent escalating levels of residential treatment. The absolute key takeaway here is matching the code perfectly to your facility's specific licensing and the patient's daily per diem rate. Using the wrong residential tier code isn't just a minor error, it's an instant, glaring red flag for payers.
Finally, let's hit Section 4, streamlining your revenue cycle. Because honestly, knowing the CMS rules and having the right codes is only half the battle. Operational execution by your staff is the rest of it. This is exactly where dedicated technology stacks become a real game changer. Platforms built specifically for this industry, like Behave Health's revenue cycle management software, are designed to act as a safety net that ensures 3 critical steps happen flawlessly. Step 1, you submit clean claims with the exact CPT codes and modifiers we just discussed. Step 2, you drastically reduce denials on that crucial first pass. And Step 3, you actually accelerate your reimbursement. By tying your clinical notes, treatment plans, and insurance authorizations directly into your billing software, you pretty much eliminate the human error that leads to rejected claims.
So, I want to leave you with this provocative thought to take back to your team. Are your claims truly hitting the mark on the first pass? Seriously, take a hard, honest look at your current denial rates and your concurrent review workflows. If you aren't actively optimizing your revenue cycle around these specific 2024 coding and telehealth nuances, you are literally leaving essential facility revenue on the table. So, are your systems truly ready? Thanks so much for exploring this with me today.